My name is Dr. Christina Rahm, and I'm the chairman of the International Science Nutrition Society and the founder and the president of Rahm Thomas University. Today, I want to talk about a case study that was done at the International Science Nutrition Society. The case study was done on eczema and atopic dermatitis by Dr. Tina Bosnick and Dr. Norbert Keskage, Dr. Dori Narbo, and Dr. Christina Rahm. This particular patient had eczema or atopic dermatitis, which is a very common chronic skin disease. It's not comfortable and it can progress and can lead to other types of issues. It affects about 31 million Americans and a lot of people internationally. The symptoms include itching, drying, and sensitive skin, inflamed skin, scaly patches of skin, sometimes oozing and crusting, and a lot of other things can happen with even infections occurring in bacterial and viral areas. In this case study, this was a 2-year-old female. Dr. Tina Bosnick was the treating physician. She treated the patient with inflammation patches on her entire body. She could not find a way for this particular patient to have traditional treatments without adverse side effects. Therefore, she tried a proprietary blend. She used 1 drop in the morning and 1 drop at night of the proprietary blend that had silica, vitamin C, and trace minerals. She then went to 2 drops in both the morning and night and followed the elimination diet protocol to get rid of anything that could possibly irritate the skin. After 1 month, there was a report of no flares of the skin. Her bowel movements were regular and normal. Her skin improved significantly, with some remaining inflammation patches on the skin, but everything else was calm. There were no side effects reported in this patient.